if I were to get diagnosed with iron deficiency or told I had low ferritin, these are the 5 things that I would do, being that I'm a hematologist, which means I'm a doctor that specializes in blood disorders and disorders of iron. Number 1, I would make sure I'd gotten all the iron tests done that help to best diagnose iron deficiency. So not just ferritin, not just iron level, you also need to make sure that you're getting the labs required to calculate a transferrin or iron saturation. And combined, this is how we best diagnose iron, see how truly low someone is, and also track it over time. Number 2, I'd really question why I was iron deficient. Well, iron deficiency is the most common nutritional deficiency and is so common in women, that doesn't mean that it's normal. And unless you're truly having excessively heavy menstrual cycles, you had a recent trauma or surgery, some big blood loss event, or you truly eat a restrictive diet or have some sort of malabsorption syndrome, iron deficiency isn't normal. And those cases are what we call iron deficiency of unknown cause, and 90% of them are due to some pathology in the GI tract. So I would want to get a colonoscopy and possibly an endoscopy and upper scope to make sure I wasn't missing some source of chronic blood loss or some sort of inflammatory or infectious condition that was preventing my absorption. Number 3, if I was going to get an iron supplement, I would look for one that was marketed as easy to tolerate, easy on the stomach. There's so many different forms of iron supplements, and many of them can really make people's stomach hurt, give them constipation, and just make it really hard to actually take when you need to. I would personally prefer an iron bisglycinate, an iron glycinate, or potentially a heme iron supplement, but there's a lot of great ones on the market. You just have to find one that works for you. Number 4, when I took that iron supplement, I'd make sure I was taking it with vitamin C, or it was combined with vitamin C, and many supplements are. I would make sure I was spacing it out from calcium supplements or high calcium foods. And I would make sure that I wasn't taking it at the same time as a big zinc, magnesium supplement, or the same time as coffee, tea, or other high phytate foods like legumes and starchy foods. All those things combined can just make these elemental sources of iron a little harder to absorb. And 5, I would of course look for ways to incorporate more iron in my diet. That would be more meat sources. Heme iron in meat sources is always the easiest to absorb, but you could also find vegetarian sources. Those ones, the same rules as the supplement applies. Have to make sure it's with vitamin C, avoiding all those other things that inhibit absorption. And a bonus one is that I would want to get my labs rechecked several months later to see if it was all working, because even with all of that, sometimes it's not enough. And if that's not enough, we have many other things we can do, like iron infusions, just to make sure people are getting enough and feeling and living their best.